Gather equipment. Check each medication order against the original physician's order according to the agency policy. Clarify any inconsistencies. Check the patient chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Unlock the medication cart or drawer, enter passcode, and scan employee identification if required. Prepare medication for one patient at a time. Read the MAR and select the proper medication for the patient's medication drawer or unit stock. Compare the label with the MAR, check expiration dates, and perform calculation if necessary. Scan the barcode on the package if required. Prepare the required medications. For the unit dose packages, place unit dose package medications in a disposable cup. Do not open wrapper until at the besides. Keep narcotic and medications that required special nursing assessment in a separate container. For a multi-dose containers, when removing tablets or capsules from a multi-dose bottle, pour the necessary number into the bottle cup and then place the tablets in a medication cup. Break only score tablets if necessary to obtain the proper dosage. Do not touch tablets with hands. And for the liquid medication in multi-dose bottle, when pouring liquid medication in a multi-dose bottle, hold the bottle so the label is against the palm. Use appropriate measuring data when pouring liquids, and read the amount of medication at the bottom of the meniscus at eye level. Wipe the lip of the bottle with a paper towel. When all medication for one patient have been prepared, recheck the label with the MAR before taking them to the patient. Replace any multi-dose containers in the patient drawer or unit stock. Lock the medication cart before leaving it. Transport medications to the patient's bedside carefully and keep the medication in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient. Usually, the patient should be identified using two methods. Compare information with the MAR or CMAR. Check the name and identification number of the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify herself, verify the patient identification with a staff member who knows the patient for the second source. Complete necessary assessment before administering medication. Check allergy bracelet or ask patient about allergies. Explain the purpose and action of each medication to the patient. Scan the patient's barcode on the identification band if required. Assist the patient to an upright or lateral position. Administer medications. Offer water or other permanent fluids with pills, capsules, tablets, and some liquid medication. Ask whether the patient prefers to take medication by hand or in a cup. Remain the patient until each medication is swallowed. Never leave medication at the patient's bedside. Perform hand hygiene. Leave the patient in a comfortable position. Check on the patient within 30 minutes or time appropriate for drug to verify response to medication.